Have you ever wondered about the intricate protections surrounding your brain and spinal cord, and what happens when those safeguards are briefly accessed for medical reasons? It is truly fascinating how our bodies are designed to protect such vital systems. A spinal tap, also known as a lumbar puncture, can sometimes lead to a cerebrospinal fluid leak, or CSF leak, if the small opening made by the needle in the dura mater does not seal properly after the procedure. This allows the fluid, which normally cushions the brain and spinal cord, to continue escaping. The primary reason a spinal tap can cause a cerebrospinal fluid leak is related to the puncture in the dura mater, which is a tough, protective membrane around the brain and spinal cord. When the needle passes through this membrane to access the cerebrospinal fluid, it leaves a small hole. Normally, this hole closes naturally, allowing the dura to heal. However, if the hole does not seal completely, or if the tear is too large, cerebrospinal fluid can continue to seep out into the surrounding tissues. Several factors influence the risk of a cerebrospinal fluid leak. The size of the needle used is significant. A larger diameter needle creates a bigger hole, making it harder for the dura to seal. The type of needle also plays a role, with some newer, atraumatic designs, often called pencil point needles, pushing aside the fibers of the dura rather than cutting them, which reduces the risk. Furthermore, the number of attempts to access the spinal fluid and the patient's position immediately after the procedure can also contribute to whether a leak develops. If you experience symptoms suggesting a cerebrospinal fluid leak after a spinal tap, such as a severe headache that worsens when you sit or stand up but improves when you lie down, it is important to contact your doctor right away. Your healthcare team might recommend conservative measures like bed rest, hydration, and caffeine, or, in some cases, a procedure called a blood patch. A blood patch involves injecting a small amount of your own blood into the epidural space, where it clots and seals the leak, providing much-needed relief. Understanding the connection between a spinal tap and a potential cerebrospinal fluid leak highlights the careful balance medical professionals maintain during diagnostic procedures. It empowers you to discuss risk factors and recovery expectations with your doctor, ensuring you feel prepared and informed about every step of your health journey.